This presentation is about Sister Callista Roy and Roy's adaptation model. My name is Sister Callista Roy, and I was born in 1939 in Los Angeles, California. I graduated with a Bachelor's of Arts degree in nursing from Mount St. Mary's College in 1963. I graduated with my master's degree in pediatric nursing from the University of California, Los Angeles in 1966. I graduated with a master's degree in sociology in 1973, and I developed the adaptation model of nursing in 1976. I then earned a doctorate in sociology in 1977, and all throughout my nursing school career, I was a sister of St. Joseph of Carondelet. I worked as a staff nurse and in numerous administrative positions at St. Mary's Hospital in Tucson, Arizona, and at St. Joseph's Hospital in Lewiston, Idaho. I became a faculty member at my alma mater, Mount St. Mary's College, in 1996. I have over 100 publications. I've been awarded 4 honorary doctorate degrees, and I was elected to the American Academy of Nursing in 1978. A little bit of background on my adaptation model. I would categorize it as a grand theory. Grand theories, by definition, are representations of the broad nature, purpose, and goals of the discipline. As I state in my theory, the individual is a biopsychosocial adaptive system, and the nurse promotes adaptation by modifying external stimuli. Both the individual and the environment are the driving forces that require revision in order to promote positive adaptation. I think this fits very well with grand theories, as the concepts and the relationships that I describe are very abstract and not operationally defined. Key concepts. Adaptation is the individual's ability to cope with the constantly changing environment. The adaptive system consists of 2 major subsystems of coping mechanisms. The regulator subsystem receives input from the external environment and changes the person's internal state, processing it through the neurochemical endocrine channels. The cognator subsystem receives input from external and internal stimuli and processes it through cognitive pathways. Adaptive modes are ways that a person adapts, and I use 4 examples in my model. Physiological is determined by the need for physiological integrity. Self-concept is determined by the need for interaction with others. Role function is determined by the need for social integrity, and this refers to the performance of duties based on the given positions of that individual in society. And interdependence involves ways of seeking help, affection, and attention. The adaptive level is determined by the combined effects of the stimuli. Focal stimulus immediately confronts the individual. Contextual stimuli are all other stimuli present in the environment, and these stimuli influence how the individual deals with the focal stimulus. And residual stimuli are beliefs, attitudes, or traits that have an indeterminate effect on the present situation. Some key terms in Roy's adaptation model include the person, who is an individual who is in constant interaction with a changing environment, which leads to adaptation. Health, which is a state and process of being and becoming integrated and whole. The environment is ever-changing, having both internal and external components. And nursing, where nurses act to modify stimuli, affecting adaptation by increasing, decreasing, or maintaining stimuli. My adaptation model is applicable to many disease processes. In this research study by Karen Jennings, it is utilized to promote and provide care to patients with anorexia nervosa. AN is a severe psychiatric disorder that has a high mortality rate due to lack of prompt treatment with life-threatening medical consequences, as well as the high suicide rates that accompany it. Nurses treating patients with AN often take on an interdisciplinary role and are expected to maintain a therapeutic relationship with the patient. This includes providing consistency, directness, empathy, respect, and transparency. Individuals with AN receive stimuli to support that caloric restriction is effective in controlling their emotional state and gives them the ability to be autonomous. With the utilization of the RAM, nurses identify the patient's adaptation levels, identify behaviors that may negatively influence weight restoration, and provide interventions to alter defense mechanisms and promote adaptation. Some interventions that apply to the modes that I have mentioned before include, for interdependence, regularly assessing and monitoring emotion regulation difficulties. For physiological, this could be monitoring the body weight and vital signs, recording and monitoring their caloric intake, and providing structure surrounding meals. For role function, it could include regularly assessing the perception of autonomy and sense of control. And for self-concept, it could include regularly assessing and monitoring the severity of over-evaluation of shape and weight, and discussing how over-evaluation of shape and weight impacts self-concept and treatment. Using an example from my own clinical practice, I was able to utilize Roy's adaptation model with a young patient who was newly diagnosed with acute myeloid leukemia. The patient was experiencing very typical clinical signs and symptoms of a newly diagnosed leuk. They needed to physiologically adapt to the need for immediate packed red blood cell and platelet transfusions. They had never had a transfusion before and didn't quite understand why they needed one, so I intervened by explaining to them how there is a shortage of normal blood cells, which happens when the leukemia cells crowd out the normal blood-making cells such as red blood cells and platelets in the bone marrow. The patient was able to rely on the supportive family throughout this process. They were also able to react to the stimulus of the cancer diagnosis with the normal grieving process and assess their own need for social work's involvement. The patient was also able to assess the temporary stepping down from being a single parent and needing to give their child to a family member in order for them to work on their own personal health so they could better take care of their child. And this concludes my presentation on Sister Callista Roy and Roy's adaptation model.